KEYMAKER-U03 is a clinical trial designed to test combination treatments in a refractory setting for patients with advanced kidney cancer. The current standard of care is to sequence tyrosine kinase inhibitors or a HIF inhibitor. So the question this trial basically is asking is, can we combine treatments, either pure immunotherapy arms, targeted treatment arms, to improve efficacy for our patients? And the trial data that I'm getting to present is the targeted treatment arms. So I'm looking at pembrolizumab plus belzutifan or a combination of lenvatinib plus belzutifan. And I think the important thing when you're considering any efficacy data, of course, is to know what the patient population is. And it is a very refractory patient population. So 50% of patients, when they entered this trial, had had 3 or more prior lines of therapy. And so kind of in that context, we were then assessing efficacy. ORR is the primary endpoint. We first saw that pembrolizumab plus belzutifan in this refractory patient population had an ORR of 20%, which is pretty similar to what we see in a LITESPARK-005 belzutifan monotherapy arm. So maybe they're not seeing a large difference in the ORR. In the lenvatinib plus belzutifan arm, the primary endpoint was an ORR of 47%, and there we saw a median PFS also that was 12.5 months. So I think that was encouraging. We already know that as this trial was ongoing, there's a larger randomized phase 3 that's looking at that exact same combination, lenvatinib plus belzutifan, against cabozantinib in the second-line setting. That is LITESPARK-011. And so that should, I hope, will be reading out, in the future and give us even more information. But I think, in that context, the idea of can we enhance efficacy in this refractory patient and delay the time to progression might be beneficial for patients. I think we don't know the mechanisms of resistance to frontline PD-1 checkpoint inhibitors. And so it's in that context that we're testing these novel regimens. We know from CONTACT-03 and TNIVO2 that it's not helpful to just do continuation of checkpoint inhibition if a patient is progressing on frontline checkpoint inhibitor. So I think trying novel treatments in that refractory setting was the goal and kind of the hypothesis behind this. I think, again, very refractory patient population where we would maybe see an objective response rate in the 20% range. So seeing an ORR of, 47% from lenvatinib plus belzutifan. And then the numbers, again, very small, but a secondary endpoint was looking at duration of response. The median follow-up currently on the trial is only 17 months, so it's still quite early. But the duration of response in the lenvatinib plus belzutifan arm was 22 months. So I think in a subset of patients, they are achieving benefit, and maybe that's by decreasing the primary progressive disease rate of belzutifan alone when you're adding that upfront TKI, and then still getting on the back end, maybe the tail of the curve that's coming with HIF inhibition. Yeah, I think there's a lot of great exploration going on this right now. So I mentioned the LITESPARK-011, so that's studying it in the second-line setting. And then we also know there's a frontline triplet that's looked at pembrolizumab, lenvatinib, and belzutifan. And, from a biologic standpoint, it makes sense to put belzutifan pretty early on in the treatment regimen because we know HIF biology essentially drives pathogenesis in kidney cancer. So I'm very curious to see, where this combination treatment ends up.